Video is all situated. But like Jessica said, we have some objectives and some purposes for tonight. But we just want to go through the videos, really to be informed. In our communities, as physicians, as pharmacists, we're going to be viewed as leaders in healthcare, but we're also going to be viewed as leaders in general. And part of that is being educated on topics like these, and to be able to discuss them with our patients, to be able to talk about why their medications cost so much or how much it costs to go to the doctor. That's part of these decisions. But just be informed, and when we go to vote, everybody in here should be able to vote after tonight. If you haven't registered, there's voter registrations in the back as well. So.
All right, so just before we get started, I'm Dr. Mothpan. I'm advisor of NCPA. Dr. Alexander and Dr. Calhoun from APHA ASP are here as well. So first of all, thank you all for coming. I'm really happy with how many of you are here, especially our students from the College of Medicine. Thank you very much for coming over and joining us tonight. Just some sort of rules for tonight, because everybody gets heated whenever politics get involved. There's a lot of strong opinions. Some of the debates are quite comical with things that are said. But the purpose of this debate is simply to encourage you to be aware of candidates' views. So to make you consider when you're getting ready to vote, not voting just on a party line because you align with that party, but considering what all these candidates say about healthcare, because they say some pretty scary things from whatever party you're looking at. Certain people want to import medications from Canada. Some people are not sort of putting a firm stance on vaccines not causing autism, who are doctors. And so that's what we're really trying to encourage, is just being aware of what these candidates say, what they feel, what their past voting history is, and how that affects you as a future physician or as a future pharmacist. So there's no discussion tonight of appropriateness or lack thereof of candidates' policies. Once this event is done, I hope that you all will leave and we'll discuss this and have some strong discussion. But within this room, we're simply watching and viewing and understanding what these policies are. So if we do get to that point, you will be asked to leave. Again, I want you to be politically involved. I want you to be politically engaged, but just because of the format of this being within the College of Pharmacy and within student organizations, any discussion has to occur outside of this building. So once you're home, as you're leaving the building, by all means. And mostly, I just hope that you all leave and get informed. It's an exciting time to be healthcare practitioners. It's also a little bit scary. But this is not meant to be doom and gloom. As the P3s know, this is my soapbox, and I love, love, love policy and advocacy, so hopefully you all will at least see how it's relevant and how it impacts you. So thank you all again for coming, and then is your show again. Thank you.
Okay, so the format, I'm actually going to take the PowerPoint down and you guys can just follow along, but basically, as you can see, we just have each the Democratic and the Republican debates listed. We're going to start with the first Democratic debate that was in October, and I've got YouTube pulled up. I'm just going to go through the links, let you guys see them, and we aren't going to go through all the debates, obviously. There are too many. I think there's already been 6 Republican and 4 Democratic. Just follow along and we'll get started.
Can you guys see, by the way, this lighting okay? Good for you guys? Good. All right, cool.
Almost 90% own almost as much wealth as the bottom 90%. That it is wrong today in a rigged economy that 57% of all new income is going to the top 1%. That when you look around the world, you see every other major country providing health care to all people as a right, except the United States. You see every other major country saying to moms that when you have a baby, we're not going to separate you from your newborn baby because we are going to have medical and family paid leave like every other country on earth. Those are some of the principles that I believe in, and I think we should look to countries like Denmark, like Sweden, and Norway and learn from what they have accomplished for their working people.
Okay, and then one thing I want you guys to note as we're going through, obviously our nominees have a lot to talk about, so they can't talk about healthcare all night, but it's almost scary how little that they do talk about healthcare in a debate. In some cases, some of these debates, it's like less than a couple minutes for the entire debate, so that's a little bit scary. Okay.
My good friend Jim Red, for his service to this country in so many ways. Jim and I, under Jim's leadership, as he indicated, passed the most significant veterans education bill in recent history. We followed suit with, a few years later, passing under my leadership the most significant veterans health care legislation in the modern history of this country. When I was a young man, I'm not a young man today. When I was a young man, I strongly opposed the war in Vietnam.
I think that's it. That one. Okay. Would it be difficult for you guys to see if I just stay in that window pane, or is it too small?
Fine, it's fine.
Okay. All right. Then I'll just stay there. That way we're not.
How American is it running for president?
I know
You
that,
are.
but the point being is that progressives did vote against that for that reason. My view right now, it always has been, is that when you have 11 million undocumented people in this country, we need comprehensive immigration reform. We need a path toward citizenship. We need to take people out of the showers.
Come on, Carlos. Secretary Clinton, Governor O'Malley wants to open up Obamacare to millions of undocumented immigrants and their children, including almost 90,000 people right here in Nevada. Do you?
Well, first of all, I want to make sure every child gets health care. That's why I helped to create the Children's Health Insurance Program, and I want to support states that are expanding health care and including undocumented children and others. I want to open up the opportunity for immigrants to be able to buy in to the exchanges under the Affordable Care Act. I think to go beyond that, as I understand what Governor O'Malley has recommended, so that they would get the same subsidies, I think that it raises so many issues. It would be very difficult to administer. It needs to be part of comprehensive immigration reform when we finally do get to it.
Governor O'Malley?
Yeah, Juan Carlos, I think what you've heard up here is some of the old thinking on immigration reform, and it's why it's gridlock. We need to understand that our country's made stronger in every generation by the arrival of new American immigrants. That is why I have put out a policy for comprehensive immigration reform. That is why I would go further than President Obama has on DACA and DAPA. I mean, we are a nation of immigrants. We are made stronger by immigrants. Do you think for a second that simply because somebody's standing in a broken queue on naturalization, they're not going to go to the hospital and that care isn't going to fall onto our insurance rates? I am for a generous, compassionate America that says we're all in this together. We need comprehensive immigration reform. It'll make wages go up in America, $250 for every
Senator Webb, do you support the undocumented immigrants getting Obamacare?
I wouldn't have a problem with that. Let me start by saying my wife was an immigrant. She was a refugee. Her family escaped from Vietnam on a boat, her entire extended family, after the communists took over, when hundreds of thousands of people were out there and thousands of them were dying. She went to 2 refugee camps. She never spoke English in her home, and she ended up, as I said, graduating from Cornell Law School. That's not only the American dream, that's the value that we have with a good immigration system in place.
The more our children learn, the more they will earn, and that's true of children who have yet to be naturalized but will become Americans.
Senator Sanders, you talked about your record on the Veterans Affairs Committee. You served on that committee for the last 8 years, including 2 years as its chairman, while veterans died waiting for health care. You and Senator McCain ultimately addressed the issue with bipartisan legislation. Why did it take 18 Inspector General reports and a CNN investigation and others before you and your colleagues took action?
Well, I was chairman for 2 years. And when I was chairman, we did take action. What we did is pass a $15 billion piece of legislation which brought in many, many new doctors and nurses into the VA so that veterans in this country could get the health care when they needed it and not be on long waiting lines. And the other part of that legislation said that if a veteran is living more than 40 miles away from a VA facility, that veteran could get health care from a community health center or the private sector. As a result of that legislation, we went further than any time in recent history in improving health care for the men and women of this country who put their lives on the line to defend us.
Governor Chafee, you and Hillary Clinton both voted for the Patriot Act, which...
All right, and then moving on to the second Democratic debate. This was in November of last year.
Follow up on that $250 a month cap. Wouldn't the pharmaceutical companies and the insurance companies just pass that cost on to the consumers in the form of higher premiums?
Well, we're going to have to redo the way the prescription drug industry does business. For example, it is outrageous that we don't have an opportunity for Medicare to negotiate for lower prices. In fact, American consumers pay the highest prices in the world for drugs that we help to be developed through the National Institutes of Health and that we then tested through the FDA. So there's more to my plan than just the cap. We have to go after price gouging and monopolistic practices and get Medicare the authority to negotiate.
Governor O'Malley, you...
Okay, what they mentioned there at the beginning, the $250 price cap, what that is that's one of Hillary Clinton's platforms, is she wants to, through the health care, whether it's the Affordable Care Act or whatever it morphs into, that there would be a max $250 per month that patients would have to pay on their prescriptions. So you might hear that come up again.
Great numbers of them love their country enough to do more again in order to create more opportunity for America's middle class.
Secretary Clinton, Americans say that health care costs and wages are their top financial concerns, and health care deductibles alone have risen 67% over the past 5 years. Is this something that Obamacare was designed to address, and if not, why not?
Well, look, I believe that we've made great progress as a country with the Affordable Care Act. We've been struggling to get this done since Harry Truman, and it was not only a great accomplishment of the Democratic Party, but of President Obama. I do think that it's important to defend it. The Republicans have voted to repeal it nearly 60 times. They would like to rip it up and start all over again, throw our nation back into this really contentious debate that we've had about health care for quite some time now. I want to build on and improve the Affordable Care Act. I would certainly tackle the cost issues, because I think that once the foundation was laid with a system to try to get as many people as possible into it, to end insurance discrimination against people with pre-existing conditions or women, for example, that yes, we were going to have to figure out how to get more competition in the insurance market, how to get the costs of particularly prescription drugs but other out-of-pocket expenses down. But I think it's important to understand there's a significant difference that I have with Senator Sanders about how best to provide quality, affordable health care for everyone. And it's a worthy debate. It's an important one that we should be engaged in.
It is a worthy debate. Senator Sanders, a quick response, and then we'll get into health care again later.
I am on the committee that helped write the Affordable Care Act. We have made some good progress. Now what we have to take on is the pharmaceutical industry that is ripping off the American people every single day. I am proud that I was the first member of Congress to take Americans over the Canadian border to buy breast cancer drugs for 1/10 the price they were paying in the United States. But at the end of the day, no doubt, the Affordable Care Act is a step forward. I think we all support it. I believe we got to go further. I want to end the international embarrassment of the United States of America being the only major country on earth that doesn't guarantee health care to all people as a right, not a privilege. Also, what we should be clear about is we end up spending, I think the Secretary knows this, far more per capita on health care than any other major country, and our outcomes, healthcare outcomes, are not necessarily.
And Nancy, I really wish you'd come back to me on this one, John, because we've actually found a way to reduce hospital costs. So whenever we come
Governor, you're breaking the rules.
Sorry, we're going to have to cut for a commercial. in the future.
All right, Nancy Cordes has a question.
Back to health care by popular demand. First to you, Senator Sanders. You prefer to scrap Obamacare and move to a single-payer system, essentially Medicare for all. You say you want to put the private insurance companies out of business. Is it realistic to think that you can pull the plug on a $1 trillion industry?
It's not going to happen tomorrow. And it's probably not going to happen until we have real campaign finance reform and get rid of all these super PACs and the power of the insurance companies and the drug companies. But at the end of the day, Nancy, here is the question. In this great country of ours, with so much intelligence and so much capability, why do we remain the only major country on earth that does not guarantee health care to all people as a right? Why do we continue to get ripped off by the drug companies who can charge us any prices they want? Why is it that we are spending per capita far, far more than Canada, which is 100 miles away from my door, that guarantees health care to all people? It will not happen tomorrow. But when millions of people stand up and are prepared to take on the insurance companies and the drug companies, it will happen, and I will lead that effort. Medicare for all, single-payer system is the way we should go.
Secretary Clinton, back in 1994, you said that momentum for a single-payer system would sweep the country. That sounds Sanders-esque, but you don't feel that way anymore. Why?
Well, the revolution never came, and I waited, and I got the scars to show for it. We now have this great accomplishment known as the Affordable Care Act, and I don't think we should have to be defending it among Democrats. We ought to be working to improve it and prevent Republicans from both undermining it and even repealing it. I've looked at the legislation that Senator Sanders has proposed, and basically he does eliminate the Affordable Care Act, eliminates private insurance, eliminates Medicare, eliminates Medicaid, TRICARE, Children's Health Insurance Program, puts it all together in a big program which he then hands over to the states to administer. And I have to tell you, I would not want, if I lived in Iowa, Terry Branstad administering my health care. Democrats, we ought to proudly support the Affordable Care Act, improve it, and make it the model that we know it can be.
Well, let me just say something.
30 seconds.
We don't eliminate Medicare. We expand Medicare to all people. And we will not, under this proposal, have a situation that we have right now with the Affordable Care Act. We have states like South Carolina and many other Republican states that because of their right-wing political ideology are denying millions of people the expansion of Medicaid that we passed in the Affordable Care Act. Ultimately, we have got to say as a nation, Secretary Clinton, is health care a right of all people, or is it not? I believe it is.
I'm sorry, Governor, we've got to take a break or the machine breaks down.
You're watching the Democratic debate here on CBS.
Alrighty, we'll move to the third Democratic debate now. We just did the first two.
And that was in December.
Teddy Roosevelt were alive today. And the governor makes a good point about trade. Anti-trade, anti-monopoly activities. Wall Street today has too much political power. It has too much economic power. To get deregulated, listen to this. They spent $5 billion in lobbying and campaign contributions over a 10-year period.
Senator Sanders.
Wall Street is a threat to the economy. They've got to be broken up.
Thank you, Senator.
And we're going to move on to health care. Secretary Clinton, the Department of Health and Human Services says more than 17 million Americans who are not insured now have health coverage because of Obamacare. But for Americans who already had health insurance, the cost has gone up 27% in the last 5 years. While deductibles are up 67%, health care costs are rising faster than many Americans can manage. What's broken in Obamacare that needs to be fixed right now, and what would you do to fix it?
Well, I would certainly build on the successes of the Affordable Care Act and work to fix some of the glitches that you just referenced. Number one, we do have more people who have access to health care. We have ended the terrible situation that people with pre-existing conditions were faced with where they couldn't find at any affordable price health care. Women are not charged more than men any longer for our health insurance. And we keep young people on our policies until they turn 26. Those are all really positive developments. But out-of-pocket costs have gone up too much, and prescription drug costs have gone through the roof. And so what I have proposed, number one, is a $5,000 tax credit to help people who have very large out-of-pocket costs be able to afford those. Number two, I want Medicare to be able to negotiate for lower drug prices, just like they negotiate with other countries' health systems. We end up paying the highest prices in the world. And I want us to be absolutely clear about making sure the insurance companies in the private employer policy arena, as well as in the Affordable Care exchanges, are properly regulated so that we are not being gamed. And I think that's an important point to make, because I'm going through and analyzing the points you were making, Martha. We don't have enough competition, and we don't have enough oversight of what the insurance companies are charging everybody right now.
But you did say those were glitches.
Yes.
Just glitches?
Well, they're glitches because
27% in the last 5 years, deductibles up 67%.
it is, because part of this is the startup challenges that this system is facing. We have fought as Democrats for decades to get a health care plan. I know, I've got the scars to show from the effort back in the early 90s. We want to build on it and fix it, and I'm confident we can do that. And it will have effects in the private market. And one of the reasons in some states why the percentage cost has gone up so much is because governors there would not extend Medicaid. And so people are still going to get health care, thankfully, in emergency rooms, in hospitals. Those costs are then added to the overall cost, which does increase the insurance premiums for people in the private.
Senator Sanders, I want you to respond to what she was saying, but you're instead calling for single-payer health care. No, people won't have to pay deductibles or premiums, but they will have to pay new taxes. Can you tell us specifically how much people will be expected to pay?
Let me say this. I serve as a member of the Health Education Committee that helped write the Affordable Care Act. Much of what Secretary Clinton said about what we have done, among other things, ending the obscenity of this pre-existing situation is a step forward. 17 million more people have health care. It is a step forward. But this is what we also have to say. Not only are deductibles rising, 29 million Americans still have no health insurance, and millions of people can't afford to go to the doctor. Major crisis in primary health care. Here is the bottom line. Why is it that the United States of America today is the only major country on earth that does not guarantee health care to all people as a right? Why is it that we spend almost 3 times per capita as to what they spend in the UK, 50% more than what they pay in France, countries that guarantee health care to all of their people, and in many cases have better health care outcomes? Bottom line, this ties into campaign finance reform. The insurance companies, the drug companies are bribing the United States Congress. We need to pass a Medicare for all single-payer system. It will lower the cost of health care for a middle-class family by thousands of dollars a year.
Senator Sanders, you didn't really tell us specifically how much people will be expected to pay.
But they will not be paying, Martha, any private insurance. So it's unfair to say in total.
But you can't tell us a specific.
I can tell you that adding up the fact that you are not paying any private insurance, businesses are not paying any private insurance, the average middle-class family will be saving thousands of dollars a year.
Okay,
Staying in the third debate.
Such a good response. But I want to quickly say that one of the areas that Senator Sanders touched on in talking about education and certainly talking about health care is his commitment to really changing the systems. Free college, a single-payer system for health care. And it's been estimated we're looking at $18 to $20 trillion, about a 40% increase in the federal budget. And I have looked at his proposed plans for healthcare, for example, and it really does transfer every bit of our healthcare system, including private healthcare, to the states to have the states run. And I think we've got to be really thoughtful about how we're going to afford what we propose, which is why everything that I have proposed, I will tell you exactly how I'm going to pay for it, including college.
Thank you, Secretary Clinton. Thank you.
Back to you, David. Thank you. We're going to get right into this, Senator, because I want to ask about taxes next, and this is included. She was asking about that.
What Secretary Clinton is for, as you know, because I know you know a lot about healthcare, you know that the United States per capita pays far and away more than any other country. And it is unfair simply to say how much more the program will cost without making sure that people know we are doing away with the cost of private insurance and that the middle class will be paying substantially less for health care under single payer than under Secretary Clinton's proposal.
Secretary Clinton, hold on.
It is your proposals, and your proposals go and send the healthcare system to the states. And my analysis is that you are going to have to get more taxes out of middle-class families. I'm the only person on this stage saying no middle-class tax raises. That is out the table as far as I'm concerned.
All righty, and our last clip from the third.
So many families across the country, and in particular right here in New Hampshire, heroin. There's a stunning new figure out. A recent poll, 48% here in this state alone say they know someone who has abused heroin. We're going to turn tonight to Dan Toohey of the New Hampshire Union Leader, who has this question.
New Hampshire has been hard hit by the heroin epidemic. We're on track to have twice as many overdose deaths this year as in 2013. What specifically would you do to address this crisis?
Senator Sanders, I'm going to take this to you first because you've seen what's happened with heroin right on the border in your own state.
Look, this is a tragedy for New Hampshire. It is a tragedy for my state of Vermont. It is a tragedy all over this country. The number of heroin deaths are growing very, very significantly. What do we do? Well, first off, this may seem like a radical idea, but I think we have got to tell the medical profession and doctors who are prescribing opiates and the pharmaceutical industry that they have got to start getting their act together. We cannot have this huge number of opiates out there throughout this country where young people are taking them, getting hooked, and then going to heroin. Second of all, the reason that I believe in a healthcare for all program, we need to understand that addiction is a disease, not a criminal activity. And that means radically changing the way we deal with mental health and addiction issues. When somebody is addicted and seeking help, they should not have to wait 3-4 months in order to get that help. They should be able to walk in the door tomorrow and get a variety of treatments that work for them. So those are some of the areas that I think we've got to move on.
Senator, thank you. Secretary Clinton.
You know, on my very first visit to New Hampshire in this campaign, I was in Keene, and I was asked, what are you going to do about the heroin epidemic? And all over New Hampshire, I met grandmothers who are raising children because they've lost the father or the mother to an overdose. I met young people who are desperately trying to get clean and have nowhere to go because there are not enough facilities. So this is a major epidemic, and it has hit New Hampshire and Vermont particularly hard. I've had 2 town halls, one in Keene, one in Laconia, dedicated exclusively to talking about what we can do, and I've heard some great ideas about how law enforcement is changing its behavior, how the recovery community is really reaching out. And I was proud to get the endorsement of Mayor Walsh of Boston, who has made his struggle with alcoholism a real clarion call for action in this arena. So I've laid out a 5-point plan about what we can do together. I would like the federal government to offer $10 billion over 10 years to work with states, and I really applaud Governor Hassan for taking up this challenge and working with the legislature here to come up with a plan. We have to do more on the prescribing end of it. There are too many opioids being prescribed, and that leads directly now to heroin addiction. and we have to change the way we do law enforcement. And of course, we need more programs and facilities. So when somebody is ready to get help, there's a place for them to go. And every law enforcement should carry the antidote to overdose, naloxone, so that they can save lives that are on the brink of expiring.
Secretary, I actually know a great deal about this issue. And I have a dear friend, played music with him for years. Remember when he came home with his baby girl, and now she's no longer with us because of addiction and overdose. The last time in New Hampshire, I had to take a break shortly after landing and call home and comfort a friend whose mother died of an overdose. Drugs have taken far too many of our citizens. It's a huge public health challenge. In our own city, I mentioned before, we have become the most addicted city in America, but together every single year, I expanded drug treatment funding in our city, and then I expanded it in our state, and we were saving lives every single year, doing the things that work, intervening earlier, understanding the continuum of care that's required until we got hit, like every other state, in the United States, especially in New Hampshire and in the Northeast, with this opioid addiction, the overprescribing. I agree we need better. We need to rein in the overprescribing. But I have put forward on my plan a $12 billion federal investment. We have to invest in the local partnerships. And the best place to intervene, the best indicator of when a person is actually on the verge of killing themselves because of an addiction, is at the hospital. That very first time they show up with a near miss, we should be intervening there. That's what I said to my own public health people. What would we do if this were Ebola? How would we act? So many more Americans have been killed by the combination of heroin and these highly addictive pain pills, and yet we refuse to act. There are things that can be done. Go onto my website. My plan is there. It's one of 15 strategic goals I've set out to make our country a better place by cutting these sorts of deaths in half in the next 5 years.
Governor O'Malley, thank you. Martha? Alrighty, and we'll move to the last Democratic debate, just from this last. What was it? Sorry. We have a couple more remaining debates for the Democratic candidates. That's on January 25th at the CNN Town Hall, and then February 11th is on PBS, the network, and then on March 9th, the Miami-Dade College.
Yeah, and obviously the January 25th was yesterday, but not in time for us to analyze it. So transitioning into the Republican debates, would you guys have any questions about individual candidates' personal policies? You can ask those afterwards and we can see. Starting in the Republican debates, the first one was August of 2015.
And by not arming them.
Governor Kasich, you chose to expand Medicaid in your state, unlike several other governors on the stage tonight, and it is already over budget by some estimates, costing taxpayers an additional $1.4 billion in just the first 18 months. You defended your Medicaid expansion by invoking God, saying to skeptics that when they arrive in heaven, St. Peter isn't going to ask them how small they've kept government, but what they have done for the poor. Why should Republican voters, who generally want to shrink government, believe that you won't use your St. Peter rationale to expand every government program?
Well, first of all, Megan, you should know that President Reagan expanded Medicaid 3 or 4 times. Secondly, I had an opportunity to bring resources back to Ohio to do what? To treat the mentally ill. 10,000 of them sit in our prisons. It costs $22,500 a year to keep them in prison. I'd rather get them their medication so they could lead a decent life. Secondly, we are rehabbing the drug addicted. 80% of the people in our prisons have addiction, certain problems. We now treat them in the prisons, release them in the community, and the recidivism rate is 10%, and everybody across this country knows that the tsunami of drugs is threatening their very families. So we're treating them and getting them on their feet. And finally, the working poor, instead of them having come into the emergency rooms where it costs more, where they're sicker and we end up paying, we brought a program in here to make sure that people could get on their feet. And you know what? Everybody has a right to their God-given purpose. And finally, our Medicaid is growing at one of the lowest rates in the country, and finally we went from $8 billion in the hole to $2 billion in the black. We've cut $5 billion in taxes, and we've grown 350,000 jobs.
Gentlemen, we're turning to a new subject that
what the Commander-in-Chief does, they would be able to carry it out. And if we don't tie their hands behind their back, they will do it extremely effectively.
Gentlemen, the next series of questions deals with Obamacare and the role of the federal government. Mr. Trump, Obamacare is one of the things you call a disaster.
Complete disaster, yes.
Saying it needs to be repealed and replaced.
Correct.
Now, 15 years ago, you called yourself a liberal on health care. You were for a single-payer system, a Canadian-style system. Why were you for that then, and why aren't you for it now?
First of all, I'd like to just go back to in July of 2004, I came out strongly against the war with Iraq because it was going to destabilize the Middle East, and I'm the only one on the stage that knew that and had the vision to say it, and that's exactly what happened. The Middle East became totally destabilized. So I just want to say, as far as a single payer, it works in Canada, it works incredibly well in Scotland. It could have worked in a different age, which is the age you're talking about here. What I'd like to see is a private system without the artificial lines around every state. I have a big company with thousands and thousands of employees, and if I'm negotiating in New York or in New Jersey or in California, I have like one bidder. Nobody can bid. You know why? Because the insurance companies are making a fortune because they have control of the politicians. Of course, with the exception of the politicians on the stage. But they have total control of the politicians. They're making a fortune. Get rid of the artificial lines, and you will have yourself great plans. And then we have to take care of the people that can't take care of themselves, and I will do that through a different system.
Hey, Mr. Trump, hold on one second.
Newsflash.
I know, hold on, Senator Paul.
Newsflash, the Republican Party's been fighting against the single-payer system for a decade. So I think you're on the wrong side of this if you're still arguing for a single-payer.
I don't think you heard me. You're having a hard time tonight.
All right, Mr. Trump.
And thank you, grow the economy by growing Washington. One report last year showed that 6 of the top 10 wealthiest counties in America were in or around Washington, D.C. I think most of us in America understand that people, not the government, creates jobs. One of the best things we can do is get the government out of the way, repeal Obamacare, rein in all the out-of-control regulations, put in place an all-the-above energy policy, give people the education and skills that they need to succeed, and lower the tax rate, reform the tax code. That's what I'll do as president, just like I did in Wisconsin.
Governor Christie, I want to engage you and Governor Huckabee in a subject that is a big issue in both of your campaigns, and that is entitlement reform. You say that to save the system, you want to raise the retirement age, have to raise the retirement age, and to cut benefits for Social Security and Medicare, and you say that some of the candidates here on the stage are lying. Governor Huckabee says he can save Social Security and Medicare without doing any of that. Is he lying?
No, he's not lying. He's just wrong. I mean, so there's a difference. Listen, I'm the only guy on this stage who's put out a detailed 12-point plan on entitlement reform, and here's why. Because 71% of federal spending right now is on entitlements and debt service. 71%. And we have spent the last hour and 5 minutes talking about the other 29%, and no time on the 71%. And that makes no sense. Now, let me tell you exactly what we would do on Social Security. Yes, we've raised the retirement age 2 years and phased it over 25 years. That means we raise it 1 month a year for 25 years when we're all living longer and living better lives. Secondly, we would means test Social Security for those who are making over $200,000 a year in retirement income and who have $4 to $5 million in liquid assets saved. They don't need that Social Security check. Social Security is meant to be to make sure that no one's worked hard and played by the rules and paid into the system grows old in poverty in America. If we don't deal with this problem, it will bankrupt our country or lead to massive tax increases, neither one that we want in this country.
Governor Huckabee, you say that changing entitlements, the kind of thing that Governor Christie is talking about would be breaking a promise to the American people. And you say that you can keep those programs, save Social Security, save Medicare, without those kinds of reforms through a fair tax, which is a broad tax on consumption. Please explain to Governor Christie how that would work and how you could save these programs without the kind of painful reforms he says we need.
Let's all be reminded 60 million Americans are on Social Security. 60 million. A third of those people depend on 90% of their income from Social Security. Nobody in this country is on Social Security because they made the decision when they were starting work at 14 that they wanted to trust some of their money with the government. The government took it out of their check whether they wanted them to or not. And if a person goes to 65, they're going to spend 51 years with the government reaching into their pocket at every paycheck. Now here's the point. Whose fault is it that the system is screwed up? Is it the recipients or is it the government? And if Congress wants to mess with the retirement program, why don't we let them start by changing their retirement program and not have one, instead of talking about getting rid of Social Security and Medicare that was robbed of $700 billion to pay for Obamacare. It's always that the government figures that they can do this off the backs of people, many of whom are poor, and depend on that money. And I just think it's fundamentally lying to the people and stealing from them, and we shouldn't be doing it.
Well, Chris.
30 seconds.
Yeah, sure. And I don't disagree with ending Congress's retirement program. I'm a governor. I don't have a retirement program in my state. I don't disagree with that. But here's the news for the American people. He's complaining about the lying and stealing. The lying and stealing has already occurred. The trust fund is filled with IOUs. We can't fix the problem just by entering Congress's retirement. That's worth about this much. We need to go at the fundamental problem. And the fundamental problem is that this system is broken. It has been stolen from. We have been lied to. We need a strong leader to tell the truth and fix it.
All right, this is 30 seconds finally.
Well, you ask about how we fund it. One of the reasons that Social Security is in so much trouble is the only funding stream comes from people who get a wage. The people who get wages is declining dramatically. Most of the income in this country is made by people at the top who get dividends and capital gains. The fair tax transforms the process by which we fund Social Security and Medicare, because the money paid at consumption is paid by everybody, including illegals, prostitutes, pimps, drug dealers, all the people that are freeloading off the system now. That's why it ought to be a transformed system.
All right, enough.
So the next Republican debate was September of last fall.
That marriage license, then there should be someone in her office to be able to do it. And if the law needs to be changed in the state of Kentucky, which is what she's advocating, it should be changed.
Let me go to my colleague Dana Bash, who has a question.
Governor Kasich, Senator Cruz is so committed to stripping federal funds from Planned Parenthood that it could result in shutting down the federal government in just about 2 weeks. Do you agree with Senator Cruz's tactic?
Well, I agree that we should defund Planned Parenthood. I don't know many people in America that don't think that we should. And in my state, we're trying to figure out how to get it done because we are threatened with the federal government taking all of our Medicaid money away. I think there's a way to get this done by giving governors the ability to be able to act to defund Planned Parenthood. But when it comes to closing down the federal government, we can be very careful about that. When we shut the government down, if we have a chance of success, and it's a great principle, yes, the President of the United States is not going to sign this. And all we're going to do is shut the government down, and then we're going to open it up, and American people are going to shake their heads and say, what's the story with these Republicans? So I think there is a way to get to cutting off the funding for Planned Parenthood. I was in the Congress for 18 years, balanced the budget, cut taxes, got it done, changed welfare, went around the president to get welfare reform done. There are ways to do it without having to shut the government down, but I'm sympathetic to the fact that we don't want this organization to get funding, and the money ought to be reprogrammed for family planning in other organizations that don't support this tactic. But I would not be for shutting the government down because I don't think it's going to work out.
Thank you. Senator Cruz, I would just add that on this stage not that long ago, Senator Graham said that this tactic that you're pushing would tank the Republicans' ability to win in 2016.
Well, let me tell you, Dan, number one, I'm proud to stand for life. These Planned Parenthood videos are horrifying. I would encourage every American to watch these videos. See senior Planned Parenthood officials callously, heartlessly bartering and selling the body parts of human beings. And then ask yourself, are these my values? These are horrifying. On these videos, Planned Parenthood also essentially confesses to multiple felonies. It is a felony with 10 years jail term to sell the body parts of unborn children for profit. That's what these videos show Planned Parenthood doing. Absolutely. We shouldn't be sending $500 million of taxpayer money to funding an ongoing criminal enterprise. And I'll tell you, the fact that Republican leadership in both houses has begun this discussion by preemptively surrendering to Barack Obama and saying, we'll give in because Obama threatens a veto. You know, Obama's committed to his principles, his liberal principles. He will fight for them. He says, I will veto any budget that doesn't fund Planned Parenthood, and Republicans surrender. We need to stop surrendering and start standing for our principles.
Governor, I want to go to you. Isn't what Senator Cruz says a surrender by Republicans?
Yeah, well, I can tell you is this: we didn't surrender in New Jersey 6 years ago, as the brand new first ever pro-life governor of New Jersey since Roe versus Wade. I defunded Planned Parenthood, and I vetoed Planned Parenthood funding now 8 times in New Jersey. Since the day I walked in as governor, Planned Parenthood has not been funded in New Jersey. We've stood up, and every one of those vetoes has been sustained. But here's the problem. We're fighting with each other up here. We agree. Let's ask Hillary Clinton. She believes in the systematic murder of children in the womb to preserve their body parts down in a way that maximizes their value for sale for profit. It is disgusting, and the American people need to hear it. We shouldn't be fighting with each other. She's the real opponent. She's the real problem.
Governor, the reality is, in just 2 weeks' time, we are going to be facing a question about whether or not it's enough to shut down the government to make that statement because there's still a Democrat in the White House.
I'll tell you what I've been willing to fight for. Tell you what I'd be willing to fight for. Why didn't we put tax reform on the president's desk so we could simplify this tax system?
Yes or no,
it's
you
really
support the
important, Dad.
shutdown?
We got to talk about what we would be willing to shut down for. Why don't we put tax reform on this president's desk and make him veto it if that's what he wants to do? Why haven't we repealed and replaced Obamacare? Make him veto if that's what he wants to do. And why don't we do the same thing with Planned Parenthood? We elected a Republican Congress to do this, and they should be doing it, and they're not, and they're giving the president a pass.
Dana, I'd like one more time. I'm sorry, I just want to get
I put it in the list, Dana.
Okay.
We should be doing these things and forcing the president to take action.
you would
Let's
support
force him to do what he says he's going to do.
Dana,
Now, I don't know
I'd like-
whether he'll do it or not, but let's force him to do it.
Dana, I'd like to link these two issues, both of which are incredibly important. Iran and Planned Parenthood. One has something to do with the defense of the security of this nation. The other has something to do with the defense of the character of this nation. You have not heard a plan about Iran from any politician up here. Here's my plan. On day one in the Oval Office, I will make 2 phone calls. The first to my good friend Bibi Netanyahu to reassure him we will stand with the state of Israel. The second to the Supreme Leader to tell him that unless and until he opens every military and every nuclear facility to real anytime, anywhere inspections by our people, not his, we, the United States of America, will make it as difficult as possible to move money around the global financial system. We can do that. We don't need anyone's cooperation to do it. And every ally and every adversary we have in this world will know that the United States of America is back in the leadership business, which is how we must stand with our allies. As regards Planned Parenthood, anyone who has watched this videotape, I dare Hillary Clinton, Barack Obama to watch these tapes. Watch a fully formed fetus on the table, its heart beating, its legs kicking, while someone says we have to keep it alive to harvest its brain. This is about the character of our nation. And if we will not stand up and force President Obama to veto this bill, shame on us.
I want to continue on the subject. Governor Bush, you recently said while discussing Planned Parenthood, quote, "You're not sure we need $500 million for women's health issues." Now, you since said that you misspoke. You didn't mean to say women's health issues, but Donald Trump said that quote, that comment, which Hillary Clinton did seize upon immediately, will haunt you the same way Mitt Romney's 47% video haunted him. Tell Donald Trump why he's wrong.
Well, he's wrong on a lot of things, but on this he's wrong because I'm the most pro-life governor on this stage. I got to act on my core beliefs. It's part of who I am. Life is a gift from God, and from beginning to end, we need to respect it and err on the side of life. And so I defunded Planned Parenthood. We created a climate where parental notification took place, We were the only state to fund crisis pregnancy centers with state monies. We were totally focused on this, and I would bring that kind of philosophy to Washington, D.C. So here's a solution to this. Title 10 of the HHS funding, there's something that was called the Reagan Rule. It was passed in 1988. And in that rule, it was defined, and the courts approved this, that a Planned Parenthood, you couldn't separate the money between the actual abortion procedures, and there are 330,000 abortions that take place in this clinic, and their promotion of it. He interpreted it the right way. The courts ruled in his favor, and Planned Parenthood did not get funding during that time until President Clinton came in. When I'm elected president, we will restore that interpretation of Title 10, and this deal will be finished.
Thank you, Governor Bush. Donald Trump, let me just...
Alrighty, we're going to stay in the second debate.
Welcome back to CNN's Republican presidential debate at the Reagan Library here in Simi Valley, California. Many people on social media wanted us to ask about marijuana legalization. Senator Paul, Governor Christie recently said, quote, "If you're getting high in Colorado today, where marijuana has been legalized, enjoy it until January 2017, because I will enforce the federal laws against marijuana." Will you?
I think one of the great problems and one of the American people don't like about politics is hypocrisy. People who have one standard for others and not for themselves. There's at least one prominent example on the stage of someone who says they smoked pot in high school. And yet the people who went to jail for this are poor people, often African Americans and often Hispanics, and yet the rich kids who use drugs aren't. I personally think that this is a crime for which the only victim is the individual. And I think that America has to take a different attitude. I'd like to see more rehabilitation and less incarceration. I'm a fan of the drug courts, which try to direct you back towards work and less time in jail. But the bottom line is the states, we say we like the 10th Amendment until we start talking about this. And I think the federal government's gone too far. I think that the war on drugs has had a racial outcome and really has been something that's really damaged our inner cities. Not only do the drugs damage them, we damage them again by incarcerating them and then preventing them from getting employment over time. So I don't think that the federal government should override the states. I believe in the 10th Amendment, and I really will say that the states are left to themselves.
I want to give the person that you called a hypocrite an opportunity to respond. Do you want to identify that person?
Well, I think if we left it open, we could see how many people smoke pot in high school.
Is there somebody you were specifically thinking of?
Well, you know, the thing is
You're talking
that...
about me.
Yeah, I was talking
I wanted to make it easier for him. Yeah. So 40 years ago, I smoked marijuana, and I admit it. I'm sure that other people might have done it and may not want to say it in front of 25 million people. My mom's not happy that I just did. That's true. But here's the deal. Here's the deal. We have a serious epidemic of drugs that goes way beyond marijuana. What goes on in Colorado, as far as I'm concerned, that should be a state decision. But if you look at the problem of drugs in this society today, it's a serious problem. Rain, you know this because you're campaigning in New Hampshire like all of us, and you see the epidemic of heroin, the overdoses of heroin that's taking place. People's families are being torn apart. It is appropriate for the government to play a consistent role to be able to provide more treatment, more prevention. We're the state that has the most drug courts across every circuit in Florida. There are drug courts to give people a second chance. That's the best way to do this.
But let me respond. The thing is that in Florida, Governor Bush campaigned against medical marijuana. That means that a small child like Morgan Hens, who has 500 seizures a day, is failing on 9 traditional medications, is not allowed to use cannabis oil, and that if they attempt to do that in Florida, they will take the child away, they will put the parents in jail, and that's what that means. If you're against allowing people to use medical marijuana, you'll actually put them in jail. And actually, under the current circumstances, kids who had privilege like you do don't go to jail, but the poor kids in our inner cities go to jail. I don't think that's fair, and I think that we need to acknowledge it, and it is hypocritical to still want to put poor people in jail.
I don't want to put poor people in jail, Randall. Here's the deal.
You oppose medical marijuana?
No, I did not oppose when the legislature passed the bill to deal with that very issue. That's the way to solve this problem. Medical marijuana on the ballot was opened up. There's a huge loophole. It was the first step towards getting to a Colorado place. And as a citizen of Florida, I voted no.
But that means you'll put people in jail.
I want to go right now.
You brought my issue up.
That's true. Go ahead, Christine, please.
Now, I enjoyed the interplay. Thank you, gentlemen. I just say this. You know, first off, New Jersey is the first state in the nation that now says if you are a nonviolent, non-dealing drug user, then you don't go to jail for your first offense. You go to mandatory treatment. You see, as Jake, I'm pro-life. And I think you need to be pro-life for more than just the time in the womb. It gets a lot tougher when they get out of the womb. And when they're a 16-year-old drug addict in the Florida County lockup, that life is just as precious as the life in the womb. And so that's why I'm for rehabilitation, why I think the war on drugs has been a failure. But I'll end with this. That doesn't mean we should be legalizing gateway drugs. And if Senator Paul thinks that the only victim is the person, look at the decrease in productivity, look at the way people get used and move on to other drugs when they use marijuana as a gateway drug. It's not them that are the only victims. Their families are the victims too. Their children are the victims too. And their employers are the victims also. And that's why I'll enforce the federal law, while you can still put an emphasis on rehabilitation, which you've done in New Jersey.
You may respond, and then I'll bring in you, Ms. Fiorina.
Understand what they're saying. If they're going to say we are going to enforce the federal law against what the state law is, they aren't really believing in the 10th Amendment. Governor Christie would go into Colorado, and if you're breaking any federal law on marijuana, even though the state law allows it, he would put you in jail. If a young mother is trying to give her child cannabis oil for medical marijuana for seizure treatment, he would put her in jail if it violates federal law. I would let Colorado do what the 10th Amendment says. This power, we were never intended to have crime dealing at the federal level. Crime was supposed to be left to the states. Colorado's made their decision, and I don't want the federal government interfering and putting moms in jail who are simply trying to get medicine for their kid.
And Senator Paul knows that that's simply not the truth. In New Jersey, we have medical marijuana laws, which I've supported and implemented. This is not medical marijuana. This goes a much further step beyond. This is recreational use of marijuana. This is much different. And so while he'd like to use a sympathetic story to back up his point, it doesn't work. I'm not against medical marijuana. We do it in New Jersey. But I am against the recreational use of marijuana. If he wants to change the federal law, get Congress to pass a law to change it and get a president to sign it.
May I respond?
Yes, Senator Paul.
Here's the thing, is he doesn't want to make it about medical marijuana, but what if New Jersey's medical marijuana contradicts the federal law? He's saying he will send the federal government in and he will enforce the federal law. That's not consistent with the 10th Amendment, it's not consistent with states' rights, and it's not consistent with a conservative vision for the country. I don't think we should be sending the federal police in to arrest a mother and separate them from their child for giving a medicine to their child for seizures.
And Jake, I want to bring in Ms. Fiorina. I want to bring in Ms. Fiorina to this issue.
I very much hope that I am the only person on this stage who can say this, but I know there are millions of Americans out there who will say the same thing. My husband Frank and I buried a child to drug addiction. So, we must invest more in the treatment of drugs. I agree with Senator Paul. I agree with states' rights. But we are misleading young people when we tell them that marijuana is just like having beer. It's not. And the marijuana that kids are smoking today is not the same as the marijuana that Jeb Bush smoked 40 years ago. We do. Sorry, Barbara. We do need criminal justice reform. We have the highest incarceration rates in the world. 2/3 of the people in our prisons are there for nonviolent offenses, mostly drug-related. It's clearly not working. But we need to tell young people the truth. Drug addiction is an epidemic, and it is taking too many of our young people. I know this sadly from personal experience.
Q, what I'd like to... Thank you, Jake.
Alrighty, we'll round out our second debate. The second debate, sorry.
And we only have about 15 more minutes, so.
Manufacturing jobs, the kind of jobs that are far greater than minimum wage, this administration is willing to put at risk for something its own EPA says is
Thank you, Governor.
This is what
Thank you, Governor. I'm turning to another issue right now. I'm turning to another issue right now, Senator Cruz. Well, I think we've heard from several this evening. A backlash against vaccines was blamed for a measles outbreak here in California. Dr. Carson, Donald Trump has publicly and repeatedly linked vaccines, childhood vaccines, to autism, which, as you know, the medical community adamantly disputes. You're a pediatric neurosurgeon. Should Mr. Trump stop saying this?
Well, let me put it this way. There have been numerous studies, and they have not demonstrated that there's any correlation between vaccinations and autism. This was something that was spread widely 15 or 20 years ago, and it has not been adequately revealed to the public what's actually going on. Vaccines are very important, certain ones, the ones that would prevent death or crippling. There are others, a multitude of vaccines, which probably don't fit in that category, and there should be some discretion in those cases. But, a lot of this is pushed by big government, and I think that's one of the things that people so vehemently want to get rid of big government. We have 4.1 million federal employees, 650 federal agencies and departments. That's why they have to take so much of our taxes.
Should he stop saying it? Should he stop saying the vaccines cause autism?
Well, I've just explained it to him. He can read about it if he wants to. I think he's an intelligent man and will make the correct decision after getting the real facts.
Mr. Trump, as president,
I'd like to respond.
Mr. Trump, as president, you would be in charge of the Centers for Disease Control and the National Institutes of Health, both of which say you are wrong. How would you handle this as president?
Autism has become an epidemic. 25 years ago, 35 years ago, you look at the statistics, not even close. It has gotten totally out of control. I am totally in favor of vaccines, but I want smaller doses over a longer period of time. Because you take a baby in, and I've seen it, and I had my children taken care of over a long period of time, over a 2 or 3 year period of time, same exact amount. But you take this little beautiful baby and you pump. I mean, it looks just like it's meant for a horse, not for a child. And we've had so many instances, people that worked for me just the other day, 2 years old, 2.5 years old, a child, a beautiful child, went to have the vaccine and came back and a week later got a tremendous fever, got very, very sick, now is autistic. I only say it's not, I'm in favor of vaccines. Do them over a longer period of time, same amount,
Thank you.
Just in little sections.
Dr. Carson.
And I think you're going to see a big impact on autism.
Dr. Carson, you just heard his medical tape.
He's an okay doctor. But, the fact of the matter is, we have extremely well-documented proof that there's no autism associated with vaccinations. But it is true that we are probably giving way too many in too short a period of time. And a lot of pediatricians now recognize that, and I think are cutting down on the number and the proximity in which those are done.
And that's all I'm saying, Jake. That's all I'm saying.
Dr. Paul, I'd like to bring you in.
A second opinion. One of the greatest medical discoveries of all time were the vaccines, particularly for smallpox. And if you go to read a story, it's called The Speckled Monster. It's an amazing story. It was all done voluntarily, but people came in by the droves. George Washington wouldn't let his wife visit until she got vaccinated. So I'm all for vaccines, but I'm also for freedom. I'm also a little concerned about how they're bunched up. My kids had all of their vaccines, and even if the science doesn't say bunching up's a problem, I ought to have the right to spread my vaccines out a little bit at the very least.
All right, thank you so much. Coming up,
Jake.
I'm sorry, Governor Ackley, please.
I think we need to remember that there are maybe some controversies about autism, but there's no controversy about the things that are really driving the medical costs in this country. And I would really believe that the next president ought to declare a war on cancer, heart disease, diabetes, and Alzheimer's, because those are the 4 things that are causing the greatest level of cost. John Kennedy said, we'll go to the moon in a decade and bring a man back, and we did it. I grew up in the 50s. I remember the polio vaccine. We saved billions of dollars since that time because we haven't had to treat for polio. Why doesn't this country focus on cures rather than treatment? Why don't we put a definitive focus scientifically on finding the cure for cancer, for heart disease, for diabetes, and for Alzheimer's, a disease alone that will
Thank you,
cost us
Governor.
$1.1 trillion by the year 2050.
Thank you, Governor.
We change the economy and the country.
We have to take another quick break. Coming up, Ronald Reagan.
Alright, so now we're going to jump to the fifth debate that was in December.
Marco still misunderstands the immigration issue. What I put forward was an amendment that would have temporarily halted immigration from high-risk terrorist countries, but it would have started it up, but I want them to go through global entry, which is a program where we do background checks. The thing is that every terrorist attack we've had since 9/11 has been legal immigration. Marco wants to expand that. I want more rules, more scrutiny, and to defend the country, you have to defend the border.
Senator, we're going to talk about immigration in a while. But
Can I get another 30 seconds? You mentioned me again.
You heard Senator Paul, Senator Cruz talk about how important it is to protect Americans' privacy, even in a time of grave danger. Why? What's wrong with that?
Listen, I want to talk to the audience at home for a second. If your eyes are glazing over like mine, this is what it's like to be on the floor of the United States Senate. I mean, endless debates about how many angels on the head of a pin for people who never had to make a consequential decision in the executive position.
I think we clicked on
We have an error.
Sorry about that.
Go to the next one.
Before the tragedy of Paris and before San Bernardino to do just that. It requires leadership. It's not filing an amendment and calling it success. It is developing a strategy, leading the world, funding it to make sure that we have a military that's second to none, and doing the job, and making sure that we destroy ISIS there. That's how you keep America safe.
Ms. Fiorina, as you pointed out, you were CEO in Silicon Valley on 9/11. Companies there, they say they won't help the FBI now crack encrypted communications from ISIS. Should they be...
Okay, so we're going to quit there. I think we got our times on a wrong debate. But I wanted to thank you guys for coming because it is a little bit after 7:15. I don't want to take up any more of your time. So what I'm going to do, I'm going to go home after this and I'm going to go ahead and email you all this. Please take some time to look at it. I know with school, I haven't had time to keep up with the debates like I'd like to, and just tonight I've seen, some things and perspectives that I hadn't realized from some of the nominees. So, do you have any thoughts, questions before we break?
Do you want to show them the brief just real quick?
Yeah.
Kind of like the format. What they're...
Let me see if I can put it. Yeah, let me.
I think we had it up on the slideshow, but like we talked about the Democratic debates, there are a couple more Republican debates coming up, and I'm sure they'll continue to talk about healthcare as far as with everything else also. But those are going to be on January 28th on Fox News, February 6th, ABC News, February 13th, CBS, February 25th, CNN, and then March 10th, CNN as well. So, like Jessica said, it's really hard when we're in school to stay on top of things, but keeping up with clips and briefs and different things is really good. And if you can try to watch those when those dates, put those in your calendar. I know a group of my classmates do that quite often. It's really helpful for them.
Okay, so I'll just kind of scroll through here and show you what we've done. First started out with just a history of how presidents have affected healthcare in the past. Sometimes I think presidents don't get as much, talk about it. They do, of course, during a presidential race, but I think a lot of times we throw that on Congress, but presidents really do have the ability to change the path of healthcare, so I think it's important that we take note. And then we have some information. I think you got a copy of this and where you can get information. And in this document, we took all the information from their different candidates' websites. So it's not that we necessarily had a healthcare related website that they had gone through and already like gotten everything ready for. So we just took the candidates at their word. So, you know, take it. You can do more research. Okay. And then we just go through each candidate and just focus on what is important to them, what their ideas are. Some of them have, you know, they've spent more time developing what their platform is on healthcare than others. So it's an interesting thing to look through. And like I said, it's 30 pages, so didn't want to kill more trees than we had to. So,
like we talked about in the purpose and the objectives, is really just to get it out there so we can know, you know, what these people stand for. They can talk about it during a debate, and we can hear it. And we heard a lot of clips tonight, really good clips that can better understand these people. But our leaders and organizations put together information that these people put out. You know, they put this out there, and they want us to know that about them. So it's really good to be educated, regardless of how you vote and how you believe, that, you know, what these people stand for, and that's what we're going at tonight.
So, and I wanted to say a special thank you to Dr. Mossband, because over our Christmas break, she spent her time going through all of those debates. So I appreciate all that time. So, all right. Well, thank you guys. I appreciate you coming. I'm really happy.
30 seconds.
What?
Next deal.
Absolutely.
Again, thank you all so much for coming. I think it's really important, and I thank you all for spending your evening to come in here. The reason that I wanted Scott and Jessica to show you this is it's 2 pages per candidate, so they're short and sweet, and they're designed to really touch on key pieces affecting healthcare. And hopefully what these debates showed you, because I spent a lot of time listening to them and had a lot of laughs with my husband, is candidates from both sides of the fence are saying things that for me as a pharmacist are a little bit scary. So the medical marijuana discussion, my husband and I talk about a lot, is that states' rights or is that the DEA's right? Is it even any of our candidates' decisions to make that determination? Because it's technically the DEA's job and the FDA's job to determine if a medication is a controlled substance and who gets to use it, how they get to use it. Also, are we comfortable importing medications from Canada? What type of healthcare system do we want? And so there's not necessarily one right or wrong answer, but you have to determine where do you think is the best way to sort of access these resources to create these structures. And so I think that's what we all hope that you get away from this, is to really look at your candidate and not vote just because they're an R or a D. And I'll steal this from Dr. Calhoun, but you should be a P. And so what affects you are an M, what affects you is your profession, and what are you comfortable with getting behind from that standpoint. But thank you all so much for coming tonight. Anything else? Thank you guys.
If you're not registered to vote, do that. They're in the back. There's voter registration forms. You can't